So welcome back to this webinar on lifestyles and hepatocellular carcinoma. My name is Dufour, and I'm talking on physical activity on hepatocellular carcinoma. I would like to thank the organizers for the excellent organization of these webinars. I have a few disclosures, but I don't think they're relevant for this presentation. I would like to cover today the role of physical activity on risk of hepatocellular carcinoma, the role of physical activity in patients with hepatocellular carcinoma already diagnosed with hepatocellular carcinoma. What are the mechanisms of physical activity on the risk of hepatocellular carcinoma and the mechanism of physical activity on the growth of hepatocellular carcinoma? So physical activity of cancers, there is a huge literature on that. We know that physical inactivity or sedentarity is actually a risk factor for cancers, breast, colon cancers. Regarding physical activity, most of the data concern breast cancer and colorectal cancer. For breast cancer, you decrease the incidence, you decrease the risk of recurrence, and you also decrease the risk of mortality. So it's really worth to tell women with breast cancer to have physical activity. Same for colorectal cancer, where colorectal cancer reduces the risk of colon cancer and also improve the survival. So knowing that, what is about physical activity and hepatocellular carcinoma? I think the first data on this topic has been published 10 years ago. It's a prospective cohort of more than 400,000 subjects in a private health screening firm in Taiwan. And with a follow-up of 8.5 years, they had 1,668 incidence hepatocellular carcinoma, and they looked at activity, physical activity in these individuals. So you have three categories. You have inactive, low active, and quite active. Oops, sorry. With physical activity in MET, in hours, and you see you have a hazard ratio showing a reduction of the risk to develop hepatocellular carcinoma in this population. Asian data, what about other countries? There's data from the US, which has been published a year later in 2013, is 500,000 of US individuals followed for 10 years with 628 hepatocellular carcinoma. And here they looked at the number of times these individuals had a 20-minute physical activity per week. And here also you can see that you have a reduction in the risk of hepatocellular carcinoma. There is a dose effect, but what I find quite appealing is that you already have an effect with only 20 minutes of physical activity a week. You reduce already the risk. You reduce it even further if you do more, but you don't need to do much to have an effect. Now there is this very interesting paper published in 2018, which is captured the physical activity data for 497 patients with HCC based on an NIH cohort of nearly 3,000 individuals. Here they actually capture the physical activity in terms of hours per week at 4 time points across life. So you have, late teenager, you have in the mid-20s, you have at 40, and you have at 55. And then you identify different patterns. So you have the individuals who are always sedentary. In contrary, you have those who always have a physical activity. Then you have those who had a physical activity and decrease, those who had no physical activity and increase, and you have those who have physical activity, then they have, kids, family, professional duties, and they are physically less active, and then they are again active. So what's the effect of these different patterns on the risk to develop hepatocellular carcinoma? So you see that as you have regularly a physical activity in your life, you decrease the risk. Of course, if you have a physical activity at all time points, you decrease. You also, if you begin as an early adult and keep physical activity, you decrease substantially the risk. So there is an effect also in this study on the physical activity on the risk of hepatocellular carcinoma. Then there's the data from the EPIC study, which is a European cohort, nearly 500,000 individuals, 275 HCC. And here they looked also at intrahepatic bile duct cancers and non-gallbladder extrahepatic bile duct cancers. So I can already tell you that there is no effect of the total on the vigorous physical activity to the bile duct cancers. But if you looked at hepatocellular carcinoma, there is an effect. If you take the total physical activity, as you increase the degree of physical activity, you decrease the risk of a cumulative incidence of hepatocellular carcinoma. And the physical activity also, there's a dose effect if you do less than 2 hours a week or more than 2 hours a week on the cumulative incidence of hepatocellular carcinoma. So you look, but there are several publications on this topic, and there is now a systematic review looking at all the publications to December 2020, taking as a primary outcome hepatocellular carcinoma. These authors identify 7 studies, and so they have a total of 777,000 subjects. And what they found is that these publications really showed a very strong effect of physical activity to reduce the risk of hepatocellular carcinoma. You reduce by 1/3 this risk. So we can really recommend our patients to have a physical activity to reduce the risk to develop hepatocellular carcinoma. So now what about patients who have hepatocellular carcinoma and would like to change their outcome? Do they have to engage in physical activity? So we know that, in patients with cancers, the American College of Sport Medicine recommend actually physical activity, just also to improve quality of life. We know that patients who have physical activity feel better. There's an effect on the fatigue. There's an effect on the physical functions, on the anxiety and depressive symptoms. So what about hepatocellular carcinoma? There is no data currently on this. I think this might be due to the fact that our patients with hepatocellular carcinoma, either we go for a curative treatment, then they have later that they don't have cancers, or when they have cancers, then we go for a palliative therapy. Until a few years ago, they didn't have a very long life. But now that we have all these different lines of treatment, probably it would be worth to look at that. And this is actually a protocol that Helen Reeves published last year, when they plan to look into that. It's a prospective single-center, single-arm feasibility trial. And they plan to enroll 20 patients, and they will do home-based group exercise sessions twice a week for 10 consecutive weeks. That will be virtual sessions by computer, like we do today, and that will be for 30 minutes. And they will capture the effect on this physical activity on the tumor and also on the different aspects of the quality of life of these patients. So I think we will get data in the next years on this aspect, but currently this is very desert in terms of results. Let me move now to a mechanism of physical activity. So what is the mechanism underlying the physical activity and the risk of hepatocellular carcinoma? So I think we have been among the first one to look into that. We used the P10 knockout mice, specifically knocking out P10 in hepatocytes. So P10 is very important to degrade PIP3 and PIP2. So you have less activation of AKT, mTOR, S6 kinase pathway. So these mice, and it's very important to know that they are insulin hypersensitive, but they develop a NASH. And so what we did, and that we randomized the mice either to remain sedentary or to have a physical activity, which was a 1 hour for running 5 days a week for 30 weeks. And we looked at the incidence of hepatocellular in these mice. So the sedentary mice, 100% of them had hepatocellular in the liver, and 71% in the physical activity group. So you have a reduction in the hepatocellular incidence, but interestingly, there was no effect on the NASH. So both groups developed an alcoholic steatohepatitis in the liver. So we tried to understand the mechanism explaining this. Looks like the main effect is that physical activity will activate AMP kinase. AMP kinase will phosphorylate Raptor, and Raptor will deactivate the mTORC1 complex, and so the A6 kinase pathway. That was the effect that we observed in these mice. Now the group of Farrell in Australia looked also at the effect of physical activity in another strain or another model of mice. This is the phosphorus mice. So these mice are overeating and they have an insulin resistance. So there were sedentary mice. There were mice who had access to a running wheel, and they inject DEN to stimulate the formation of hepatocellular carcinoma. So they compared the effect of 6 months, and they see an effect on the sedentary mice. There was 7 out of 11 mice with tumors, and in a voluntary exercise group, there was 2 mice with HCC out of 13. So the incidence going from 64% to 15%, which is highly significant. So here also supporting the effect of physical activity, but in this model, they found another mechanism. They looked into P53, so there was a phosphorylation of P53 with exercise. There was also a higher expression of P27, which is an inhibitor of cyclin kinase. And there was also an effect of exercise on the phosphorylation on JNK kinase. And they went further, and that they repeated that in a JNK kinase knockout mice. And if they inject the DEN, these mice fail to develop hepatocellular carcinoma, showing that in their model, JNK kinase is very important. So here, in this model, which is different than the one we use, but this model is insulin resistant. And I forgot to tell you, but you probably read it, exercising improve insulin sensitivity, ameliorated steatosis and liver injury, but we didn't observe in our mice. Here they show an effect mostly on the P53. Now, what is the effect of physical activity on the growth of liver cancer? Can you affect the growth? So here we have also some data. We looked into that. We looked in a rat model. This is a rat model, ACI rat, and we inject in the liver of this rat Morris hepatoma cells, which actually are from the same animals. So there is no immunology. You don't need to immunosuppress the animals. So you inject the same amount of cells in the liver of these rats, and so you have a tumor which will grow at the same times in the cohort of animals. And so we implanted this tumor, and then we waited for the tumor to be implanted, and then we randomized the rats either to have a physical activity by running or not. So what was the effect on the tumor volume? There's no effect. Sedentary or exercise rats have the same tumor volume. But if you look at the viable tumor volume, is reduced because you have more necrosis with the physical activity. If you look at the proliferation, we injected BRDU, and so you have also an effect on the cellular proliferation, which is reduced with physical activity. And looking at the microvessel density to the perfusions of this tumor, you really have an effect here of the physical activity. Looking at the signaling pathway, the physical activity increase PTEN, also increase the phosphorylation of AMP kinase, as we've shown in the P10 knockout mice. You have an effect on the HCC phosphorylation of HCC. You have an effect on the phosphorylation of Raptor, on the phosphorylation of the S6, and also on the STAT3. So you have less phosphorylation of STAT3 and S6. So you have an effect of physical activity on several very important signaling pathways. So we also looked at the effect on the transcriptome. What's the effect of the physical activity on the transcriptome in the tumor and in the adjacent liver? So in the tumor, which is here in green, you have an effect which is very small. The largest effect of physical activity is actually in the non-tumoral liver. And what we found is actually there was a signature for the risk of hepatocellular carcinoma, which was published in the New England by Joseph Lovett, with 20 genes associated with a poor prognosis and 20 genes associated with a good prognosis. We found that physical activity was significantly affecting the expression of these genes, with 80% significantly downregulation, the poor prognosis, and 60% significantly upregulation, the good prognosis. So that may also explain maybe the effect on the risk to develop hepatocellular carcinoma. Now, recently, I think it's in press, there is a paper looking also at the physical activity on HCC growth. This is a biopsy nude mice, which are randomized to be sedentary or exercising by swimming. So they first adapt to the fact that they have to swim. Then we inject, not in the liver, but subcutaneously cells in this nude mice. We let them cells form a small tumor, and then they will swim 30 minutes a day, 5 days a week for 4 weeks. It's not a very long intervention. And they looked at the effect on the tumor. And which was also interesting in the paper is that they took the serum to look at the effect of the serums on cell growth. So what they found is actually the physical activity had an effect on the tumor growth. You see that in the exercising mice, the tumor was smaller. They find an effect on the HIF1, which is hypoxia-inducible factor, which was significantly reduced. And they found an effect also on signaling pathways, AKT, less phosphorylated, GSK3, also less phosphorylated, and interestingly, the beta-catenin. What I found also appealing and interesting in this paper is that in cells exposed to serum from the swimming mice, they had an effect on the hypoxia-inducible factor and on the AKT, GSK, beta-catenin pathways. So what can we conclude from this review of the literature is that physical activity decreases the risk of hepatocellular carcinoma. I think we should engage our patients on this. That physical activity may have benefits in patients with hepatocellular carcinoma in terms of quality of life, response to treatment, and survival, but we are lacking data, really. I think that's an interesting place to do some research. And there are data showing the physical activity affects important hepatic signaling pathways on the risk to develop hepatocellular carcinoma and also on the growth of the tumor. So don't forget to bike your liver. I thank you for your attention. I would be happy to answer your questions. Has anyone a question? Professor Ramadori.
Yeah, Jean-François, this is a really great talk. I am impressed. And also, I mean, the most impressive thing that you took serum for these animals. And so that, you know, you hypothesize that some serum factors may also influence not only the, you know, development of cancer, but also the growth of the injected cancer. That's right? Well, I understood right? So this
yes,
is
exactly.
Yeah, this is really, really relevant, very relevant topic. And of course, you know, when we do exercise, we generate a lot of cytokines. And I cannot tell you whether TNF alpha, for example, is also increased during exercise. You may know that better than I do. And let's say this could be one of the inhibitors of growth, of tumor growth. But of course, there may be several other cytokines which normally, push the growth or development. Development and growth are two different things. But I think this is a really very relevant topic.
Yeah, I think if I may say, the muscle liver axis is a very interesting one. It's going both directions actually, and there's a lot to do on this topic. Yeah. Other questions?
I would have a question. Do you think that it's important the type of the physical exercises that we recommend to the patient? I mean, or it's important just to be a physical exercise? And now I'm asking because with some exercises, for example, we can diminish the visceral adipose tissue. With some specific exercises, we can diminish the subcutaneous tissue. So I was wondering if it's important to move ourselves, but it's important also to have a more target physical exercise.
Great question, Pompilia. I don't think I can answer these questions with the data that we have so far, but I mean, we know from NASH, if we go now, not HCC, okay, if you go NAFLD, we know that if you do resistance or cardio, you have an effect. So the type of exercise doesn't have such a role. For hepatocellular, we don't know. I'm not aware of data looking into that. I don't know. But Mike Trenel might be the person who has some data on this. But this is very interesting, and effectively, as you mentioned, the type of fat you may affect with the physical activity is crucial. Yes.